These obstacles don't try to force him out of the path to chasing his goals. They're more of seduce him, try to lure him out of the path. Hello, I'm Dr. Ubong Udofie, and I'm one of the consultants in charge of the Drug Addiction Recovery Program. And our center is located within the Federal Neuropsychiatric Hospital, that's Calabar, 123 Calabar Road, Cross River State and Nigeria. So I want to briefly tell you what we do in our program and how it can benefit maybe a friend, family member struggling with alcohol, drug, and other forms of addiction. So let's begin. Our recovery program is called the Recovery Path. We liken recovery from addictions as a journey that you want to take, or that a journey that you are taking because you have observed that certain things in your life, of which the addiction is a part of, is preventing you from achieving certain goals in your life. The resource material that we use for the addiction recovery program is a workbook. It's called the Recovery Path. The cover illustrates exactly what we do in the program. We liken recovery from addiction to a journey that a person takes. And he's taking this journey because he wants to achieve something, a 6 months goal, and maybe a 2 year goal. It could be a 1 year goal or a 2 year goal, but he's on the journey because he wants to achieve a goal. But then there are certain things on the side that are trying to take him out of the journey, trying to make him not to achieve this goal. We can call this obstacles, if you may. Now, the first obstacle that he will encounter are old habits. And it's interesting to note that these obstacles don't try to force him out of the path to chasing his goals. They're more of seduce him, try to lure him out of the path. The first obstacle is old habits, and it says, leave the path, bro. Stop wasting time. The second obstacle is the old life, and it says, we really miss you. To the left side of the path, you have things like triggers. And the trigger is saying, please leave the path. You also have cravings. Come here, we need you. So these obstacles are doing everything that they can to get this person out of the recovery path. And we understand that, such that even while in recovery, these obstacles will still be a problem. And so the program accounts or accommodates for that. So the goal of the program is not just drug abstinence. The goal of the program is, by the resources that we have been able to provide for you, you will be able to achieve all the goals that you have set while handling or eliminating the obstacles in your path. Now, the very first obstacle will be the drug addiction, and in handling that, it means that we would teach them how to handle their triggers. Not only that, we'll teach them how to handle their cravings, because it's the triggers and the cravings that take a person out of the recovery path. Now, there are certain things in their life that are not really linked to drug use that will still take them out of the path. These are the old lifestyles or old habits. So, what are those things in their life that are contributing to them not meeting their goals? That's what the recovery path is all about. So not only do we achieve a goal of drug abstinence, we go beyond that to achieve relationship goals, socioeconomic goals, and other goals. Rehabilitation care is provided by a team of psychiatrists, psychologists, social workers, occupational therapists, nurses, etc. So let's talk about other addiction recovery goals, mind shift. So in the program, we take the client or the patient through two states of mind. The first mind is called the drug mind. This is the mind that happens where there is active addiction. Now, in the drug mind, the patient or the person has cravings, they have withdrawal symptoms, and most of their actions seem illogical. So they could maybe sell a generator worth 200,000 for 30,000 naira. Okay, then they are not open to logical reasoning. They're not open to reason. It's as if they are rationalizing every single thing. Now, all one needs to move from the drug mind to the clean mind is just time. So it takes about 7 to 9 weeks to move a person from the drug mind to the clean mind, which is a type of recovery. And doing nothing, just keeping him in one place, this means if I keep you in a church or a rehab facility is enough to take him to the clean mind. Now, in a clean mind, usually there's regret over past life actions. There's also absence of withdrawal symptoms. There are still urges, but they are mild to moderate. Sometimes there might be no urges. There's also the mindset that willpower or determination is all I need, and nothing can ever take me back to doing drugs. Now, most patients leave recovery program in the clean mind, and living in the clean mind, the risk of relapsing is quite high. Now, what the recovery path does is that we focus on moving you from the clean mind to the clear mind. The clear mind is another type of recovery, and it takes some time. It could take more than 6 months to finally move you from the clean mind to the clear mind. Some people, it could take less depending on how fast they are in doing the tasks allocated to the program. Now, in moving from the clean mind to the clear mind, you would need to learn a new mindset and skills. Now, what really is the clear mind all about? The clear mind says that I know that a relapse can happen tomorrow. I also know that willpower can fail me at some point in my life. And because I know that willpower can fail me at any point, in addition to having willpower, I also am holding strongly onto certain structures that will prevent me from relapsing. Now, even while holding onto the structures, the relapse still happens, I still have other structures that will take me back to recovery. So the program, the recovery path, pushes a person struggling with drug addiction from active addiction, that's a drug mind, through recovery, clean mind, and then we guide him through the clear mind. Now, this process takes about 6 months. But what we do is that we spend the first 2 months getting him from the clean mind to the clear mind, and the last month, at the third month, trying to reinforce the clear mindset. After the 3 months, we still provide support. Can be virtual support via social media groups, phone conversations, online coaching, therapy sessions for at least another 3 months to reinforce the clear mindset. If you have questions, feel free to ask them. Thank you.